Welcome to Harmonic Healing Channel. In the face of the ever-evolving COVID-19 pandemic, the emergence of the NB.1.8.1 variant presents both challenges and opportunities for global public health. This variant, a descendant of the Omicron JN.1 lineage, has exhibited remarkable propagation across multiple global regions, demanding immediate attention. To comprehend the significance of the NB.1.8.1 variant, we delve into its origin, characteristics, and the multifaceted strategies for comprehensive response. Our approach integrates conventional Western medicine, the holistic principles of traditional Chinese medicine, and evidence-based nutritional interventions. Additionally, we leverage the wisdom of the TCM theory of the 5 movements and 6 key to anticipate potential future trends in viral mutations. By understanding the unique characteristics of the NB.1.8.1 variant and applying the principles of TCM, we aim to provide valuable insights for healthcare professionals and the general public. This knowledge empowers us to develop effective prevention and treatment strategies while offering a glimpse into the future of this pandemic. Emerging in January 2025, the NB.1.8.1 variant traces its lineage back to the recombinant variant, XDV1.5.1, a member of the Omicron JN.1 family. After establishing itself as the dominant strain in China, it rapidly spread across Asia, affecting countries like Singapore, Hong Kong, and India. Subsequently, international travel facilitated its transmission to European and American nations, including the United States, France, and Germany. By May 2025, the World Health Organization designated NB.1.8.1 as a variant under monitoring. Notably, by the end of May, 22 countries had reported NB.1.8.1 sequences, signifying its global reach and transmissibility. The surge in infections in China since April 2025 has been marked by a notable increase in COVID-19 positivity rates. According to data from the China CDC, by April 2025, the positivity rate for SARS-CoV-2 among influenza-like illness, outpatient and emergency cases rose from 7.5% to 16.2%. Among hospitalized severe acute respiratory infection cases, the positivity rate increased from 3.3% to 6.3%. Official Chinese sources also identify NB.1.8.1, a 6th-generation sub-branch of the XDV variant, as the primary circulating strain. The enhanced transmissibility of NB.1.8.1 is attributed to its unique genetic composition. The spike protein of the virus has undergone several significant mutations, including A435S, V445H, and K478I. These mutations may augment the virus's capacity to bind to human ACE2 receptors, thereby facilitating cellular entry and increasing transmissibility. For instance, the K478I mutation may enhance the virus's ability to evade certain neutralizing antibodies, while the A435S mutation may diminish the efficacy of various monoclonal antibodies. The virus appears to be continually refining its mechanisms for host cell invasion. Experts, including Zhongnan Shan and those from Peking Union Medical College Hospital, have observed that the JN.1 strain exhibits a heightened affinity for the upper respiratory tract, such as the nasopharynx and throat, leading to symptoms such as dry cough and sore throat rather than high fever. This is attributed to the virus's decreased propensity to affect the lungs and cause severe pneumonia compared to earlier variants. The recent JN.1 subvariant waves, including that of NB.1.8.1 infection, have demonstrated some shifts in while general symptoms such as sore throat, fatigue, mild cough, fever, muscle aches, and nasal congestion are still prevalent. Fever is becoming less common. This may be due to pre-existing immunity from vaccination or prior infection, which could lead the body to mount a more subtle immune response. Reports from Taiwan and China indicate that NB.1 infection may be associated with a higher incidence of severe pharyngitis. Some patients may experience persistent low-grade temperature irregularities or gastrointestinal symptoms such as headache, nausea, and loss of appetite. Clinicians have noted that over 40% of individuals diagnosed in the current wave may not present with fever. 6 signals are emerging as potential indicators of new variant infections in the absence of fever. They are itchy or dry throat, dysphagia, persistent dry cough, exacerbated by swallowing and sneezing, generalized myalgia, dorsalgia, and lumbar pain, and persistent fatigue, non-restorative sleep. These symptoms should not be casually dismissed as common cold or allergy symptoms. On-the-ground reports from China. Reports from Guangzhou and Shanghai suggest a discrepancy between official narratives of a slowing trend and the experiences of citizens and medical professionals. Some citizens report widespread familial infections with severe symptoms. A clinic doctor in Guangzhou stated that many adults and children were infected and the symptoms were generally more severe than the common cold. This doctor also reported the death of a physician at a grade A Class 3 hospital due to COVID-19, causing concern among medical personnel. According to this doctor, over half of the patients visiting his clinic exhibited symptoms suggestive of COVID-19, but testing was often not performed. He raised concerns regarding alleged underreporting and potential avoidance of testing to prevent public anxiety. Severe cases requiring hospitalization and ICU admission were reported. Allegations were made regarding instructions not to report confirmed cases and to focus on disinfection measures. Official assessments indicate that the severity of illness caused by NB.1.8.1 has not increased significantly compared to other prevalent Omicron variants. The WHO's preliminary assessment indicates a low additional global public health risk. Existing diagnostic tests remain effective for detecting JN.1 and its descendant variants. However, it is important to acknowledge the limitations of these reports and the potential biases or challenges faced by healthcare workers and researchers in providing an accurate account of the situation. Access to reliable information might be restricted, and the true extent of the impact of NB.1.8.1 may not be fully known. Continued monitoring and transparency are crucial for a comprehensive understanding of the variants, characteristics, and implications. Understanding long COVID. A significant number of individuals experience persistent symptoms, termed long COVID, following the acute phase of infection. Common long COVID symptoms include cognitive impairment, anxiety, palpitations, chest tightness, and persistent fatigue. Research indicates that up to 30% of patients may experience long COVID symptoms 3 months post-infection. The risk is higher for individuals aged 65 and older. Elderly individuals have a 1.8 times higher risk of developing symptoms such as cognitive decline, fatigue, and palpitations. This increased vulnerability is attributed to slower immune function and recovery, comorbidities, and weakened organ function. Vaccination remains a crucial defense mechanism. Updated vaccines targeting JN.1 are anticipated to confer cross-protection against NB.1.8.1. Existing or updated JN.1 vaccines remain effective against symptomatic infection and severe disease caused by NB.1.8.1. For infected individuals, timely antiviral treatment is essential. Medications such as Paxlovid are generally effective if administered within 5 days of symptom onset. Other drugs, such as remdesivir and molnupiravir, also require early initiation. Continuous monitoring of drug susceptibility is vital. The emergence of the NB.1.8.1 variant underscores the importance of a comprehensive and multi-pronged approach to pandemic preparedness and response. Strengthening epidemiological surveillance is crucial for early detection and tracking of viral mutations, informing effective public health interventions. Continued investment in vaccine and pharmaceutical development holds immense potential for mitigating the impact of this variant. Moreover, fostering research into integrative medicine, such as can provide alternative therapeutic options and insights into holistic healing. Validating and integrating traditional medicine practices alongside conventional Western medicine can offer a more complete and patient-centered approach to healthcare. Equally important is the need for open communication and collaboration among nations, healthcare professionals, and researchers worldwide. Sharing data, best practices, and resources is essential for developing globally effective strategies to combat the challenges posed by NB.1.8.1 and future variants. From a traditional Chinese medicine perspective, COVID-19 is classified as an epidemic, disease arising from external pathogenic factors and deficiency of vital energy. TCM characterizes Omicron and its variants as manifesting a combination of wind, heat, dampness, and toxin. Pattern differentiation and treatment are central to TCM's approach. Common TCM pattern differentiations include wind heat invading the lungs, cold dampness stagnating in the lungs, Damp-Toxin stagnating in the lungs, and Qi and Yin deficiency. China's official guidelines provide detailed guidance on pattern differentiation and treatments. External TCM therapies such as acupuncture, cupping, gua sha, moxibustion, and herbal medicine are widely applied. A balanced diet rich in vitamins, minerals, and antioxidants plays a pivotal role in supporting the immune system and overall health. TCM dietary therapy focuses on individualized recommendations based on pattern differentiation and the 6 tastes. Lifestyle modifications, including regular exercise, stress management, and adequate sleep, are emphasized. Personal protective measures such as wearing masks, frequent hand washing, and avoiding close contact with infected individuals are crucial. Environmental hygiene measures, including regular disinfection of surfaces and proper ventilation, are also recommended. Recovery strategies. Learning from experience. TCM encourages a gradual and balanced approach to recovery. Key strategies include appropriate diet, pacing, and gradual return to activity, personalized treatment plans, and ongoing health monitoring. The theory of Wu Yun Lu Qi predicts climatic patterns in corresponding disease trends. This theory anticipates prevalent wind and fire factors in 2025. Future variants of COVID-19 may exhibit a more pronounced wind and fire nature. TCM strategies should prioritize protecting the lung metal, tonifying qi, and nourishing yin. If you find this helpful, please subscribe, hit the like button, and share this to anyone who might benefit.